exam today.
Okay.
So I'm going to start just examining her head and her scalp, and there's no obvious deformity. She's normocephalic, and I'm going to palpate the head, and she's got, her hair is thick, and she's got no alopecia, no pestilence, anything like that. Going to inspect her overall, her skin, and there's no obvious rashes or lesions. Check the temperature is warm, turgor is elastic, texture is smooth. And so I inspected the skin and the hair. I'm going to look at her nails, and cap refill is brisk. Could you put your nails together like that? She's got no clubbing. Nails are in good repair and intact. And so I'm going to continue on with the head. I'm going to check the temporal arteries and palpate +2 and +2. I'm going to listen with the bell for bruits. There's no bruits. Check the cranial nerve 5, the trigeminal nerve for the sensory branches. Close your eyes. Tell me where I touch.
Forehead.
Which side?
Left. Right cheek-ish. And my chin.
Which side?
Left. Right. It's a lot of thinking. Right forehead.
Okay, so the sensory branches are intact, and I'm going to check the motor. Can you open and close your jaw? All right, motor is intact, and while I was doing that, I checked her TMJ. Movement was smooth. There's no clicking or malalignment. And I'm going to check cranial nerve 7. Can you smile, frown, puff your cheeks out, wrinkle your forehead?
I almost forgot how to do that.
Okay, so the motor branches bilaterally of cranial nerve 7, the facial nerve are intact. And I'm going to check your sinuses. I'm going to palpate the maxillary and the frontal. Anything tender?
Nope.
All right. I'm going to move on, and I've palpated the scalp and the hair. I'm going to move on to do the eyes. So I'm going to start just inspecting externally the lashes and the lids. There's no discharges, no erythema, no lesions. I'm going to inspect the sclera. Is white. The conjunctiva is pink. No discharges. Anything tender there?
Nope.
No, or there? No discharge from the puncta. And I'm going to palpate the orbital area. No deformities there. I'm going to check her near vision with the Rosenbaum. Could you cover one eye and read the lowest line?
937826.
All right, and so she's 20/25.
Oh man.
And I would do the same thing in the other eye and document that. And I'm going to check the pupils. So look straight ahead at me. Is direct and consensual response. When I shine the light in the left eye, it constricted, that's the direct. When I shined it in the left eye, the right constricted, that's the consensual. I'll do the same thing in the other eye. I'm going to check the extraocular movements. Follow my finger. Okay. All of her, she's got full, the 6 cardinal fields fully intact. That tells me that cranial nerves 3, 4, and 6 are intact. That's the oculomotor, trochlear, and abducens. 6 abducens is when she looks laterally. Trochlear 4 is down and in. All of the others are oculomotor. I also, cranial nerve 2 was checked by the Rosenbaum. I'm going to check her peripheral fields of vision. So I'm going to line up with her and tell me when you see the fingers.
No. No. No.
Okay, so she's got full fields by confrontation. And I'm going to I would normally dim the lights to look in her eye with the ophthalmoscope. Okay, I have a red reflex, and I can see blood vessels. And if it was darker, maybe I could see her optic disc, but I can't see it. All right, so now we know we've done cranial nerves 2, 3, 4, 5, 6, and 7. I'm going to move on to her ear. I'm going to start with the external ear. They're symmetrical, no lesions, anything tender. I'm pressing on
Nope.
the tragus. And I'm going to check your hearing with the whisper test. Cover your ear.
Baseball.
Okay, and the other ear.
Football.
All right, so cranial nerve 8, the acoustic nerve, is intact. I'm going to do the Weber. Does that go to one side or both sides equally?
Both sides equally.
All right, so that's what the expected finding would be, and I'm going to do the Renee. Tell me when you stop hearing it.
No.
Can you hear it?
Yeah.
Okay, air conduction is greater than bone conduction.
I lied and said I stopped hearing it too soon.
All right, now I'm going to look in the ear. Now we of course do the same thing on the other ear. Turn this way a little bit for me. External auditory canal is clear. She's got a cone of light. TM is intact. Gray. So that all looks good. And now I'm going to move on to the nose. So externally, in the midline, there's no deformities. Breathe in, patent bilaterally. Inspect. Mucosa and turbinates, look up. Okay. Pink and moist with no lesions or discharge. And same over here. All right. And then I'm going to move on to the mouth. So I'm expecting the lips are pink and moist. Open your mouth. And the buccal mucosa is pink and moist. Lift your tongue up. There's no lesions on the tongue or the floor of the mouth. And stick your tongue out and say ah. All right, the palate rises symmetrically. The uvula is in midline. That tells me the cranial nerves 9 and 10 are, the glossopharyngeal and vagus are intact bilaterally. The tonsils look with no erythema or discharge. Pharynx is pink and moist. Stick your tongue out and move it to the side, move it to the side. All right, cranial nerve 12, the hypoglossal nerve is intact bilaterally. And shrug your shoulders up. All right, cranial nerve 11, spinal accessory nerve is intact bilaterally, so we've covered cranial nerves 2 through 12 bilaterally. We're not going to test cranial nerve 1. I'm going to move on to the neck, and I'm going to note that her trachea is midline. And I'm going to come around behind her and check her thyroid. Could you swallow for me? All right, the thyroid is non-enlarged. There's no nodules. I'm going to observe that she has no jugular venous distension. I'm going to palpate her carotids one at a time, and they're +3. And I'm going to listen to the carotids with the bell for any bruits. There are none.